As the medical community continues to mourn the loss of a nurse who died by suicide last week, they're calling for additional mental health support and are using this tragedy as a reminder to check in on one another and seek help if you're in need.
It's me under the light of 1,000 stars.
Stephanie Van Nieuwen has been described by friends as outgoing, bubbly, friendly, and always smiling. While family and friends of the 25-year-old may never know what led to her death by suicide on Friday, they're asking all who are dealing with depression to call loved ones or seek professional help.
There was no previous history of mental illness, so you kind of think, who else is feeling inside dark?
The CEO of the Registered Nurses Association is devastated by the loss and spoke with Stephanie's family, colleagues, and her long-term boyfriend, Jason, over the weekend.
She said to me, don't forget to tell your family you love them.
According to Halton Healthcare, Stephanie had worked with them on a casual basis, but had taken a job in August with Humber River Hospital. Her friends tell us that she was an occupational nurse who wanted to make a difference.
I can't help it but know that the pandemic likely had an effect.
In response, one doctor writing, the trauma that nurses are now facing is harsh, unforgiving, and overwhelming. Frontline workers need more support to avoid such tragic outcomes.
They are fully working double time, working overtime.
Dr. Randy McCabe is the director of the Mental Health and Addictions Program at St. Joseph's Healthcare Hamilton, and throughout the pandemic has seen an increasing number of frontline workers in need of help.
They've seen really hard things to see. They've been redeployed in a setting where they're putting people in body bags, days on days, really stressful, upsetting things that then they have no time to even process because they're back there the next day.
I hear it from physicians across the board that they are weary and they are tired.
According to the Ontario Medical Association, pre-pandemic, 1/3 of physicians were suffering from burnout, but they say the numbers are climbing.
We've heard of too many of our own losing the battle to burnout, losing the battle to depression in the last year. If this is you, you are not alone.
One of Stephanie's close friends writing, let us continue to protect each other, care for each other, and continue to advocate for safe nursing practices and healthy work environments. And later this evening, we will have a link to mental health resources on our website, including specific supports that are available to healthcare workers in our community.